What's gonna happen the day of your procedure? You're doing a liposuction here at Evolution ND with any of the doctors, Dr. Lee, Dr. Sayed, Dr. Ina, or myself. And I say with any of the doctors because we all follow the same protocols. The day of your surgery, if we're gonna do it under general anesthesia, you're gonna come fasting. So we ask you not to have any solid food at least the night before until midnight. If you're taking medications, let's say you have high blood pressure, you have diabetes, you have thyroid problems, then you can take your medication the day of the surgery, but with very little sip of water. The day of the procedure, you're gonna come to our surgical suite and you're gonna check in with the receptionist, and then you're gonna be passed to the pre-op area. Once in the pre-op area, you're gonna have pictures taken, you're gonna sign the consents to perform the surgery, and you have time to clarify any doubts or any question that you have before the surgery. The same day, you're gonna have an evaluation with the anesthesiologist that is gonna go through all your records and your medical conditions, any question that you have related to the anesthesia. The same day, you have another consultation with the surgeon, and if you have any additional questions before the surgery, we have plenty of time to answer all those questions. The same day as well, we're gonna be checking you in the pre-op area, all your vital signs. You're gonna have an IV line on you because we're gonna give you hydration. So you are in optimal conditions to go to surgery. Also that day, we're gonna take you pre-op pictures, and all this is happening before the surgery. That's what I tell the patients and the family, that even though the surgery is usually between 1.5 hours to 2 or 3 hours, you're gonna be here pretty much 6 to 7 hours because all this process. So you need to notify your family members or your friends that you're gonna stay here for 6 or 7 hours. It's not 6 or 7 hours surgery, it's 6 or 7 hours process. Then when you're ready, we're gonna come, we're gonna mark you, and we're gonna give you additional recommendations in case you're doing a fat transfer, in case you're doing an enhancement of your gluteal area or your breast or anything else. You still have time to give us that feedback. Then it's time to go to surgery. You're gonna go to the surgical suite. We're gonna give you the general anesthesia, if it's the case. If it's local anesthesia, we're also gonna start giving you the local anesthesia. Then after the procedure is done, you go to the recovery area when you're gonna have registered nurses watching you, one nurse per one patient. So this nurse is gonna be taking care of you the whole time while you're in the recovery area. Once you're fully recovered, fully awake, that you're able to walk and to go home, you're gonna go home the same day. And then we'll see you tomorrow to see the magic of your surgery.